When you're in the operating room, are you nervous?
No.
Adrenaline?
Nope.
What is it?
No.
There's nothing?
No, I'm calm, cool, and collected.
One-on-one with Kris Fade, the podcast.
Listen, I want to stick around. I want to live. Someone asked me the other day, I'm 63, when are you going to retire? I'm not going to retire as long as I can because I'm actually getting better with surgery. I want to slow down, but I'm still going to operate.
Rolling, 3, 2. Welcome to the show, Dr. Paul Nassif. How do we say it the Arab way is Nassif? Like
Exactly.
It's Nassif.
Yeah, Nassif, if when I'm out here, they say Nassif. In the United States, it's Nassif.
It's Nassif. Where were you born and raised?
Los Angeles.
All your whole life, huh?
Born and raised out there, trained out there. Also did a lot of training in different parts of the country, but always out there. And only visited Lebanon once, 2017.
Wow, you've only gone back. I mean, and when you went back to Lebanon, you're Lebanese by descent like myself. How was that?
Oh, I went for a medical meeting. It was great. Again, it's that service, the food, restaurants packed at night. The whole bit. It was incredible. Incredible experience.
So did you
went to the village, where
your family was from?
Yeah, and all that.
You got to get back there. Yeah. I got to get back there. I haven't gone in 4 years myself, and one of the reasons why I moved from Australia here was because I wanted to be kind of closer to Lebanon. But I've gone a few times. But I felt like every time I went back, I felt there was a part of me I felt like I was home a little bit. There was something about, I don't know, you're around your people. Do you know what I mean? Like you feel like it's your people. I don't know. It's a weird feeling. Did you always know that you wanted to do what you were doing at a young age? Like, did you know you wanted to become a surgeon?
Yeah, I knew I wanted to become a doctor at probably the age of maybe 12. But where I ended up, no clue. And that all started back actually during my residency. Remember, I'm an otolaryngologist trained. I'm head and neck surgeon.
A what? What do they call it?
Otolaryngology.
Man, could you say
otolaryngology?
Yeah. I can't even say that.
Ear, nose, and throat, simplest way to say it. And I was actually going into micro ear surgery near the brain. So tumors that involve the ear and the brain, you work with a neurosurgeon, it's microscopic. That was my favorite surgery.
Wow.
And all of a sudden, one day I did a rhinoplasty and then did a facelift, and I go, oh my God, this is like the coolest. So then I fell in love with that, and boom, that stuck.
So when you were doing a surgery, you said it's the coolest. What makes it cool? It's easier. It's cooler. It's the results. Like what is it that makes it from a surgical point of view? Like this is cool.
It actually, when I was operating, helping with the facelift or rhinoplasty or eye surgery called the blepharoplasty, it resonated with me more. It just felt like this is what I need to do. It's, the anatomy, just from start to finish, the actual surgical procedure, not the results, because I was too young to, really know what a great result was, but just doing the procedure, I just said, I love this. This is what I want to do. Just like that, instantaneously.
And when you're doing all facelifts the same, as in, is someone's face different? That would mean that you'd have to use a different technique?
Great question. Are we talking about now? Yeah, let's talk about now.
Now, yeah, I don't want to, because obviously it's changed over the years, right?
There's different procedures for facelifts. And what's happening now, which is interesting, a lot of the patients that have had all types of fillers or more stimulants to the face, or this microneedling with radiofrequency and all that, we're finding a lot of scar tissue deep below. It's making the type of facelift you do. I do what we call a deep plane facelift. I've done 12 different facelifts, but to me this is the most durable, longer acting, more natural, maybe less risks. Well, not really, because you're around the nerve of the face.
When you say risks, what's the worst case scenario that can happen?
Well, the two bad things I'm going to say that could happen, the two really bad things that could happen, one, part of the skin can die. The other thing is you can injure one of the nerves that, usually around the mouth, that controls your movement of the face.
So you can wake up from surgery and not have control of your
You
mouth
can be a little paralyzed.
forever.
And usually, better knock on wood here, never permanent with me, but yeah, you can have permanent injuries. So that's why you got to make sure you're going to a good doctor.
And so
but with the scar tissue from these other procedures that they've had, which we never thought that until recently, especially of the neck, of the face, that's causing more problems and harder surgery.
And you don't know until you're in?
Well, now you get a history, and then you have to expect it. But if you're a good surgeon, you're going to navigate around it.
So with the paralysis possibly of hitting a nerve, whatever.
Yeah.
When you're in the face, when you're cutting in or doing whatever you do you see the nerves?
So usually you can see them. However, if it's a couple different facelifts already been performed, so it's a revision, or there's a lot of scar tissue, sometimes the nerves are not going to be where they're supposed to. So you can injure a nerve. Wow. It can be trapped within scar tissue. What I tell patients in general, especially when you're doing a good neck, that they are going to have some weakness of the lower lip for maybe 3-4 weeks. Okay. It's kind of expected, but it should come back. And so patients expect that, understand it, and but it's interesting. We thought that minimally invasive procedures. I mean, I was talking about this all the time. I was saying, well, what's the next best thing? Oh yeah, it's going to be less use of a scalpel for a facelift. But now I'm kind of going backwards on that. I'm saying that, reverting from that, saying that some of those procedures are causing damage to the deeper soft tissue of the face. So now I'm kind of saying, you know what? Don't do that.
So the mic, I've heard, I think I've had a microneedling. Is that what they called?
Yeah.
Is that the machine that?
Well, microneedling, which we do. It's especially when it's superficial, but the microneedling with radiofrequency delivering heat deep below. It can cause burns, it can cause scar tissue, it can cause...
Scar tissue that you wouldn't even know that's happening because it's happening under the skin.
It's what you would not know it's happening. Or it can cause scar on top of the skin.
Sheesh. And then what about fillers? Because I know a lot of people they've had fillers, and fillers is a regular thing that people are putting in.
So now we're finding that fillers, certain fillers, not all fillers, can cause some creation of scar tissue deeper in the face.
Does it, if someone's getting fillers, should we know what the brand is? Should we be asking, or is it all the same?
I got to tell you, I mean, the hyaluronic acids, which are probably legal from different companies across the world, we're not seeing as much problems with that in general.
Okay.
It's more of these things called biostimulants that can make you build collagen, just like those other microneedling with radiofrequency. The goal is to create an injury to get new scar.
Okay.
The scar is tightening of the skin, building new collagen. Problem is that scar now is sometimes getting deeper than we think. I know we're down a rabbit hole here, getting into this whole conversation.
No, but it's interesting because there'd be so many people that would get all that done thinking that they're doing better for themselves. They're not going under the knife. So this is an easy way to get a better fix, a quicker fix, but they don't know that underneath the skin it's doing some bad things.
So now I'm going to say, you know what, let's not go that way. Now listen, superficial things.
Yeah.
Lasers.
But is Botox okay?
Botox is fine.
I have Botox sometimes.
Yeah, I do. I've done it on my Instagram.
My mum, I won't call her old because she'll kill me, but my mother, she's beautiful. She's early 70s. She'll kill me for saying that. She never had anything done. And I've always told her, like, if you ever want to go and get some Botox done or whatever, you can. She's like, I will never put chemicals in my face. It leaks to the brain and it causes dementia. She's read that or seen that somewhere. And that is fixated on my mother. And I know a lot of mothers and parents and people. Can Botox, from what we know from a medical point of view, can it go and leak into the brain?
Never heard of that.
Okay.
Never heard of that causing dementia. And again, remember, that's, again, a little bit when we're old-fashioned, we're going to think some of the old-fashioned thoughts, or there's certain things that you do. But no.
Okay.
No, but I still think even regular fillers, hyaluronic acids, used sparingly, not all the time, still a good thing. There's still, but interesting. You know what? This made a point. Let's say a young lady goes and gets fillers in her lips.
Yep.
All the time, over and over and over and over again. By putting the needle in over and over and over again, that does create some scar tissue.
Sure. So you're going to have scar tissue in the lips.
So you have a little bit, you can get a little firm lip once in a while, if you overdo it. I think if you do everything in moderation, I think you're okay. But all I'm seeing, it's funny, there's more publications now. A friend of mine just sent me a publication about complications from either threading, doing these more invasive procedures, or minimally invasive, are causing a lot of trauma and scar, especially in the neck.
When you do your facelifts,
Yeah.
do you, again, I don't know a lot about it. I've had a friend that's done it, so I've looked into that. Is it cut here? It's cut right next to the ear? And then pull, what are we actually doing? We're just pulling the skin back?
So simply based, let's talk about that deep plane facelift.
That's what you do?
Yeah. And I'm sure that's what your friend had.
Yep.
I assume. Or a good standard facelift. You go around the little temple hairline, and then you do it in front of the ear, but you hide it behind this little thing here called the tragus. Here, go back behind the ear.
Behind the ear.
And then go back along the hairline.
And that's just
And a little, maybe one here too.
And that's to hide the scarring? Is that why you're cutting there?
Well, your goal is you want to camouflage it. Now, with good stitching, that scar should be invisible. But again, you do that. You lift up the skin. Then you go in that deep plane, which is underneath the muscles. And again, you're lifting it up. The neck goes more this way. This part goes up because you want to look good. You don't want this look.
Yeah, you see that a lot.
Yeah, you want a beautiful, natural look.
So why do some people look like that? They've been stretched too much?
Yeah, well, that or the director or the vector of pull is in the wrong direction. They're going this way and doing more of the old-fashioned techniques. And then you look like you had a facelift. You got that wind-blown look. You want to look good.
Yeah, you don't want to look like it.
refreshed.
Yeah. The crazy thing is, I've got, how many kids you got now?
5.
Congratulations.
5 kids.
A recent one as well, right?
Yeah, he's 9 months old.
A baby.
Yeah, my little,
Let me see.
they're the two.
Look at him. Look at him.
The 5-year-old, and he's almost 9 months.
Beautiful, man.
Paulina and Paul.
I like it, Paul.
Paul.
I got a 2-year-old boy. I called him Cruz, like Kris Fade, Kris Fade. I want him to have the similar sort of feel. My daughters, who are 16 and 14,
Yeah.
they have already both.
So there's a big difference in age there.
Yeah, a different wives. So
Yeah,
I'm divorced.
same thing with me.
Same. We live the same.
Yeah.
They came to me, and they both already said to me, "We want to have a nose job." Right? They're 16 and 14.
Oh yeah.
Now,
Wait a minute, girls?
girls.
Yeah.
And I'm like,
That's that age. That's exactly right.
because I feel like if you've seen it, you've been doing this long enough now. Have you seen that social media has given the younger 16 and 14-year-olds the need of wanting to have more work done? Are you seeing 16-year-olds, 17-year-olds coming with their parents?
Yeah, but I've seen that before social media.
Okay.
So the 15, 16-year-old girls, especially maybe they were getting teased, they don't like the hump,
Yep.
they don't like something. That's always been a thing.
Mm-hmm.
It's always been a thing, especially in Los Angeles. Now, with the use of all these little
Apps, filters,
apps
and all
stuff
that. Yeah.
and all that, getting rid of a hump or doing something and making the tip look a little smaller.
It's crazy.
Because remember now, everyone's a celebrity on social media.
Yeah.
So yeah, it's brought it out more. However, for the full 26 years I've been doing this, it's always been a thing, especially during Christmas vacation or summer or some spring break for the young, the young girls around the age of 15, 16 to get a rhinoplasty.
When does the nose? I mean, they say the nose always keeps growing, right? It keeps getting larger.
It droops.
Okay, so
Just because it just, some of the, the little basically fibers that hold all the tissue together become a little loose and the tip starts to drop.
yeah, I feel that. My nose is just getting closer to my chest every frickin' day. I feel that. But at the age of 15 for a girl or 16 for a girl, would that be too early to have a nose job?
No.
The nose doesn't.
That's about the right age. Now, unless the pediatrician says, you know what, your daughter's going to go another 5 inches. Mm-hmm. You know, and they know that usually because we always want to get the pediatrician to get, you know, is this patient pretty much done? Well, maybe another inch. That's fine. Or, you know, a couple centimeters. But if someone is going to go through a huge growth spurt, we want to wait. But 15, 16 is pretty much the magic age where I do a lot of rhinoplasty.
Wow, because I feel like there'd be such backlash from other parents going, how dare you get your 15 or 16-year-old to have a nose job at that age? But what you're saying it's the perfect age.
It's been around for so many years. That, even sometimes younger, for getting your ears pinned back. Yeah. Those are the 2 procedures that has been okay. Now, I will tell you on the other side of the scale, what has been probably happening for the last 5, 6, 7 years is in high school, as a graduation present, the parents have been getting breast augmentation.
What?
Yeah. That is becoming more and more common. Remember, I only do face.
Yeah, but you're based in LA, so you're saying in LA, a lot of graduation presents from parents is a breast augmentation.
Yeah, you know, my kids, you know, remember I have a 22-year-old and 2 19-year-olds. They're all in college, different colleges. Wow. And these kids are showing me, you know, a bunch of the friends, okay, you know, and I've done a few of the rhinoplasties. But then the next thing goes, yeah, now she got a breast job, breast aug. And these kids are all the first year, second year in college. It's becoming a big thing.
For me as a father, I'd say that's way too young. Yeah. I don't know if you've got the same thoughts.
I'm the same thoughts. I mean, I'm going to say, but I got to tell you, it's happening a lot.
Have you ever said no to patients because you felt like they didn't need it?
Oh, yeah, that happens all the time.
You're saying...
you know, I always say no. I say no probably about 10 to 15% of the time.
You're saying no because you believe it just is not needed or they've had too much done?
Well, again, remember, that's why, especially if you watch me on Botched, we're always saying no to different reasons. One, the person maybe doesn't need it, or what they want is ridiculous, or they've already had too much, or there's a physical reason why I can't do it, or a psychological reason that I can't do it for the patient. There's all kinds of reasons.
What is the psychological thing of not realizing? It's like a guy who goes to the gym and is on steroids, right? They think they look small.
Okay, so they have some type of dysmorphia.
But and it happens for males and females from a plastic surgery point of view. I personally know women who have had so much work done, and I've begged them to stop because I know where they're going to end up looking in the next 10 years. They don't see it. They keep getting surgery done, fillers done, this done, and now they've started to look like that. You know, when you see, you're like, whoa, they don't see it. Do you know what is there a name for this?
Yeah, that's body dysmorphia
It is.
disorder.
So it's the same.
You know, and then you get into the plastic surgery addiction.
Oh my gosh.
But the point is, for example, you look in the mirror, they may think that their nose is huge.
Yeah.
They get a rhinoplasty. Now it's fine. But they still think it looks huge. They get another one, and then another one, making it smaller and smaller and smaller until the skin can die, your nose can look completely destroyed, and they keep doing it. But then the question, you know, the doctor should have enough common sense to say, hey, we're not doing this on you. But that's when they don't. Then that's when they end up in my hands to try to fix them, to try to bring them back to a little bit of normalcy.
Sure. Did you enjoy doing Botched?
Oh yeah, I mean it was a blast. It's a blast, and you know, there's something we're working on. I can't discuss it now, but maybe another year there should be something going on now again.
Because managing, you know, I did a reality show called Dubai Bling, and managing that, doing a reality show and then doing everything else that I was doing, the radio, the hosting, it's pretty full on.
Oh yeah.
So when you're filming, I became a fan of you through the show, right? And I remember watching, going to myself, are these real patients? Is there a mix between real patients and, I don't know, actors coming in? I don't know. It's a question that I've always wanted to know.
Sure, I'll tell you right now. Every patient that comes in there is real. Now, The ones that we actually operate on, that they need something and they have nowhere else to go. But then we opened up internationally. We had patients, especially a lot of Australians come in.
Yeah, seen them.
And now, do they come and they want something that's ridiculous that we're not going to do? And the whole goal there is, one, we're trying to educate also the public. Okay, this lady's got implants about as big as this table. Well, not really. But,
yeah.
And she wants bigger ones. Well, obviously, we're not going to do it.
Yeah.
But then they talk about their complications and their issues and all that. So, yes, it's entertaining. And you're seeing this girl with huge breasts, and she's in with one of her friends, and they're telling stories. But at the same point, it's entertaining, but we're trying to also basically say, don't go to that next level.
Sure.
Because here's what can happen to you. So we're educating at the same time.
Because, you see some crazy stories, and you're looking at it, and you're like, this can't be real. But I guess the people that are on there, they really want that surgery.
Yeah, no, it's real. So in other words, they really are coming in. Maybe they already know that we're going to say no to them because they've seen the show before.
But they'll get the fame maybe. They get to meet you guys.
But the funny thing is, they do go to another country, or they find another doctor, and they end up going that far.
Oh my gosh, it's scary. Have you ever thought about, like, is there a connection from? You've met a lot of these people that go too far. Is there a connection with childhood? Have you ever looked into that? About like the upbringing? Is it maybe not having a father or mother or divorce? I don't know.
Never really, with those patients, we never got into it that much. However, there's body modification. Mm-hmm. And those are the ones that come in that want the gigantic breasts, or they want a specific piece of, they think it's art to the face of their body, which we think is crazy. That's body modification, like tats, piercings. Mm-hmm. This is just a different level. And a lot of them, they already know what they want. They're very smart. They know what the risks are. And it's nothing, it's just something that they like doing. And they're not crazy, but they just know, hey, listen, this is what I want to achieve. I want, a forearm or a bicep implant. I like this look,
When you put a bicep implant in.
Oh, yeah, there's people that do calf implants.
I've seen the
calf
implants.
They're out of silicone. Put them inside the muscle, or, again, I don't do anything, but we have implants in the face. What's the difference? I'll do a chin implant on someone who's got a weak chin.
So it's a silicone chin.
You can put a silicone chin implant right here.
How do you stick it to the face?
You actually, you get a layer of scar tissue that forms around it pretty quickly. So, for example, a chin implant, something that easy. So let's say I have a young lady comes in with a big nose, but the chin is receding. Mm-hmm. So to balance things out, if, we think it's a good idea, make a small incision here, make a little pocket along on top of the bone, the mandible, jawbone, put the little implant, stitch it back up, and, khalas, as we say in Arabic, finished, we're done. And then usually it can heal very well. So we've been doing implants in the face for 40, 50 years. Maybe this is just a different type of an implant.
What's the most satisfying part of your life?
Okay, you're talking about at work, you mean?
Yeah, like at work. What's the most satisfying thing that...
When I do a big reconstruction on someone, part of the face, and it changes their life. It's something that's been destroying them. For example, let's say the last episode of Botched, season 8. This poor lady from Mexico had a tumor falling off her face this long. She had no life because she was considered a monster, deformed.
Yep.
And we actually, I don't know how I was able to do it, but I was able to remove 98% of that tumor off her face. Pretty much do a big facelift. Hard, very hard surgery. Oh boy.
How many hours?
Healing. This one really wasn't bad, maybe 6-7 hours. However, and the healing, we had some tissue that didn't do well after. We had to watch it. We had to do things. But after it all healed, she looked fantastic. She ended up getting a boyfriend, getting a job, getting a life.
That's
who wouldn't want to do that?
No.
Who wouldn't be satisfied? if you did that, wouldn't you be happy and satisfied for that you changed someone's life? Yeah. Of course. It's great.
And they don't pay for it.
On the show?
Yeah.
Well, that's part of the thing. I think, the network does something, which I don't even get involved with, but
They look after
but they're taking care of the patient. That's from the career side. But remember, what I do is hard because you try to help every patient.
Yeah.
And this is every plastic surgeon, by the way. You do the best you can. And sometimes there's complications or patients don't heal well. And that's very stressful.
I was about to say, because
watching the healing.
Yeah, the
stressful.
good side of it is when you see something that's so perfect and it's done so well. But at a percentage game, if you're doing thousands of these, there are going to be one or two cases, a low percentage, where it doesn't go the way that you planned it to go. Yeah. And as a patient, what do? You would blame the doctor, right? Like you'd be like, well, he did this or she did this. How do you? I don't want to say live with it, but how do you manage that?
So, especially with what I do, I'm doing high-risk surgery.
Yeah.
High-risk surgery means higher risk of complications and healing issues. And so I try to tell a patient in advance, I go, you know what, listen, we're going to do this rhinoplasty at your fifth one. I'm telling you now, something is going to happen. You're going to be swollen for 3 years. You're going to have something not heal well, or there's a possibility that we may have to put leeches on your nose after surgery because of decreased blood supply.
Literally leeches.
Leeches. Something is going to happen. Your nose may not heal well. You might get this scar tissue. It could not look, there's a small chance it could be worse. And does that happen? Yes, it happens. One of these issues can happen. The patients will listen, to you in the pre-op, but then after surgery, they're going to be upset still. No matter what you do to help, if a patient is upset, they're upset. And does it bother you as the surgeon? Of course it does. That's what we do. We have to deal with the good and the bad.
And with social media, does that even add another level to it as well? Because rather than just contacting you, and I'm sure you must, if we went into your inbox on your social media, it would just be pages of people pleading for you to be able to help them with some type of plastic surgery that they can't afford. Like, do you feel like you get a lot of I don't even know if you look through your messages. In my inbox, because I do a lot of radio stuff and we give away a lot of cars and we help people out, my inbox is just a plea of people like begging, I need this, Kris, could you give that? And
sure.
And it's hard because you want to be able to help everyone, but you can't help everyone.
Yeah, same thing.
You have the same sort of feels?
Yeah, but I don't, because listen, what I do is I have a doctor job, which takes at least minimally 5 days a week. A skincare company, 5 children, a beautiful wife. My time is, any extra time I have, I focus on my family.
Yeah.
So, luckily I have my nephew does my social media, so they help. Do all that.
Talk about your wife. You're so in love. You can see it by seeing you on social media. You can see what a family man you are. You've always been that family guy? You've always been the man that you are now? Or do you feel like you've changed over the years and focused on other things and focused more on that?
I think I'm becoming a better husband and a better dad to my 5 kids. I think, I'm 63. I was just telling friends of mine, because I lost my brother who was 63 3 years ago, 3 years older than me. He was kind of healthy, but something happened and he died, and it gives me PTSD. I'm worried that something's going to happen to me now. And because I have the 5 kids and I want to be around for my children. So I'm a little bit even hyper paranoid. And, it sits with me almost daily, and I think about my brother. Listen, I've lost my parents because I'm 63, obviously.
Yeah.
And so I want to be healthy. I want to be around for my children as long as I can. I have an 8-month-old boy. So I feel that extra time that I have, I want to spend it with the kids. And it's great when they're all together. It's wonderful when just the other day, this last weekend, one of the boys was back, home from school, and the other two, I had all 5 kids in the house. I just loved it. And then I take my boys out to eat, and they're men. It's great. So that to me is, of all the things, raising children is probably the hardest and best thing in my life. And being a good husband. I mean, I'm blessed. You have your second wife. I have my second wife. And, we're friends. I'm friends with my first wife. We're all together for kids weekend in college for one of the kids. And we all had a great time. To me, being a good parent, raising children, is by far the best, most hardest and rewarding thing you can do.
Yeah, I agree.
You got 3.
I got 3, so yeah, 16, 14, and 2. And here I am at the age of 45. We're debating if we have a 4th, but I'm like, am I too old to have a 4th?
Well, you're asking me.
You had one at 63. Because
hold on. I was 62.
Okay, 62. Because I started doing the maths with my wife, and she's younger than me. She's 37. Yeah. And I said, I want to be able to run around. I want to be able to run around with my kids. So all right, if we had another kid now, in 10 years' time, they're going to be 10. I'll be 55. But I'm like you. I want to be.
Yeah, you still can.
But I have, and I've had it for many years, and I've openly talked about having health hypochondria. I'm a health hypochondriac. Mm-hmm. I've been dealing with it a lot better over the years. And this all came from a friend of mine who was, I think we're in our early 20s. He's my best friend. My best friend. He got sick one day, like sore throat, cold, whatever, coma, meningitis, right? And he nearly died. We had to teach him how to walk and talk and everything again. He was in a hospital for 3.5 months. I was there every day with him. He's now good, right? But the doctor was like, he's either going to come out sort of brain damaged or he's not going to come out at all. Powers of God. He came out, he's like 95% great, right? Lives a great life. He's 45 years old with kids. That moment, when I was in my early 20s, showed me how fickle life is, like as in how life can be taken away from you. Which means since that moment, and now I'm a father, and I raised my 2 girls, since they were 5 and 3, they've been with me. I feel like I'm the only thing that they have. Now with my son, that if anything happened to dad, oh my gosh, what's going to happen to the kids? So it's had that in there. When I fly alone, man, I'm like the worst case flyer because I'm not with my children. When I'm in a plane with them, I'm fine because if anything was to happen, we go down together, right? And so I've had this health hypochondriac that I've been dealing with over the years. And I want to be as fit as I possibly can. I see people around me just dropping dead from a heart attack. You see it in the news all the time. And that freaks me out. I go get my heart checked twice a year now. Like I'm getting to put the dye in my veins. I want to see everything.
Well, guess what? So like I told you, since I lost my brother now, I never even thought about it before. But now I become like that. Because I just, I want to be as healthy as I can.
Of course.
So exercising, listen, you're fit. Yeah. I mean, I'm trying to do a good job at my age, trying to be completely active all the time.
You look good.
Because I want to actually, I want to stick around. I want to live as long as I can so I can actually see my kids have kids. I want to be a grandfather,
Yeah, no, I get it.
So I want to do it.
How are you dealing with the health hypochondria? Like, because for me, I went and did a couple of things. Some of it I felt like didn't work. Some of it did. I went and saw a hypnotist, but like not the hypnotist, like a real, like someone like a mentalist where you lie down and they really talk to you. And I felt like it actually kind of helped me. It was weird. It did really help me. They just sort of go into your thoughts and they discover why you felt like that. But I already knew why I felt like that. But I felt like it lessened the thoughts. And when the thoughts come, I know how to handle them a little bit more. I handle them a bit better. I don't let it domino effect into this really big, because I was having anxiety attacks from it.
So this is the thing for you then.
Yeah, it's a thing. Yeah,
but you've gotten better.
I got so much better. Yeah, like so much better at it. I felt like I can handle it now. I can handle it and I can live with it. And but the one thing that I do is I'm an ambassador for a hospital here, so I have everything that I ever needed and I go get everything done. I'm like, yeah, check my heart. Yeah, check this, check that. But Kris, you just had your heart checked. I'm like, yeah, I want to check it again. Like, what's wrong? I can do this. Can I get an MRI? There's no need for an MRI. I want an MRI. Can you give me an MRI? We have such great healthcare here in Dubai, where we're based, that I'm using it all because I want to make sure, like you, that I'm here for my kids. I want to see my kids. I want all that.
As long as okay, listen. I mean, the bottom line is, for you though, it was causing a problem.
Yeah,
you're getting
definitely
anxiety attacks. I mean, the goal though is to try to create that balance, where you're getting everything you need checked. Without becoming psychosomatic or hypochondriac too much. And if you have that, that's something that will be extra stress on you. Because if you're worrying all the time, then that increases your cortisol level, and that's not great for you. So
that's the worst.
I mean, so for me, am I thinking about dying all the time for something happening? No.
Okay, good.
No. And this is, but my goal though is, what could I do proactively to be healthy? And that's all you can do.
I'll do it every day.
I mean, just exercising.
I was obese. I was huge.
No, I didn't know that.
It's like 300 pounds or something.
No, I didn't know that.
Yeah, I'll show you some photos later. I lost a lot of the weight through the divorce. That was what triggered it. You go through a divorce, you want to get sexy.
Yeah. So
I tried.
You want to get sexy.
I was like, I just wanted to get fit again. I was overly weight, so really overweight. So I found health now, and health for me is like it's my savior. It's like it's better than taking a pill, going to the gym. I don't know if you feel the same, but take me to a gym, let me walk out of that gym. I feel like I'm on top of the world. I feel like I took a drug. It's for me, that was my savior, getting fit. So like 6 days a week, I'm in the gym, not for the physical side of things, but more for like it just mentally makes me feel great and allows me to do what I'm doing. If you weren't a surgeon, was there a plan B? Was there a plan B for doing? I mean, what would Paul Nassif want to do if he wasn't doing what he was doing?
Well, hold on. I mean, let's go both ways of that.
Okay.
I was in the restaurant business since I was a young kid, and I'm still actually involved in the restaurant business. So I probably would be a restaurateur, just because that's where it took me. I have a business degree from college, even though it was pre-med. So I'd probably be in the restaurant business.
Okay.
Now, if you ask me if I can pick another career, I mean, even though I'm not great, but I'm a golf fanatic. I would love to be a golf pro.
A professional golfer. I don't play golf. What's the handicap?
Mine, I'm like 17.5, which is not really that good.
Okay.
It's not horrible, but it's not good. But my goal is to get that down, and when I have free time, I love playing. I'm dressed like this.
You were going.
I'm playing golf after. Yep. I'm playing golf at one of your top places here.
Have you played golf in Dubai before?
I did twice.
Okay. Yeah, we got some good courses here.
You got some great courses.
I think there's a whole thing that's called the Race to Dubai.
I'm going to go play after this.
The Jumeirah Golf Estates?
Jumeirah Golf Estates.
Yeah, they're beautiful. I mean, again, I'm not a golfer.
That's where I'm going.
You ever played paddle? You might play pickleball, probably.
No, but I played a little pickleball before, and the padel. What is it called? Yeah. My friends play it.
Because paddle has taken over golf now as like the sport. That's where you do all your negotiations. It's where you do your business.
So is it the same thing as like pickleball? Almost?
Yeah, similar, but like I call it paddle, but some people call it padel. It's kind of like squash and tennis together. There's glass around you, so you're using the walls and.
So it's like racquetball.
Kind of like racquetball, yeah. But I haven't played racquetball. You're only playing one wall, aren't you? Aren't you playing against one wall?
No, racquetball from the old days, I recall. Wait a minute. Maybe it is. I don't know.
Yeah, I think so.
I used to play that, but that was like 40 years ago.
Have you got to play golf with, any people that we would know? Like, I'm guessing there's a lot of these celebrity tournaments that would happen. I'm guessing you're jumping on some of those. Have you?
Yeah, I played a few of these, celebrity golf tournaments. But, a friend of mine who's on the Live Golf Tournament,
Yep.
Cameron Trigali, he has hooked me up with his caddy who lives here.
Okay.
And that's who I'm playing with today.
Okay, so you're
caddy.
gonna get a good game there, right?
And this guy apparently is a good teacher. Listen, so I'm one of these guys that you can give lessons to as you're playing. Most people hate that, but I love that.
What's more pressure, being on the green, right, or in the
operating?
Yeah.
So I say this all the time.
Okay.
Not on the green, but when you're about to tee off with your driver.
Yep.
That is more stress.
My God.
Especially the first 5 holes. Like you're nervous. You got to calm down, which I'm not there yet. I think if I keep playing more and more and more, I'll get there. But that is stressful.
Are there nerves?
That's why you get nervous. Your temple's up. That's why you have a winner this week, a winner the next week. You have guys that are great, then all of a sudden,
Yeah, mental side.
You know,
When you're in the operating room, are you nervous?
no,
Adrenaline?
Nope.
What is it?
no,
There's nothing.
no. I'm calm, cool, and collected.
Because you're just so confident. You know exactly what you're doing.
I know no matter how hard the case is. Now, listen, I got to tell you, if you're doing a surgery and something is very unexpected, am I going to say, okay, shut the music off, I got to focus and I got to think? Or this section, there's so much scar, I could injure something, let me just take a break for a moment and think about how to do this and what's the best way. So yeah, that happens.
Because when people are in theater or getting operated on, like let's say it's an 8-hour surgery,
Which I do.
okay, that's what I've always wanted to know. Is there a timeout? Like, hey, we're doing 10 minutes, I'm going to go grab a coffee.
Yeah.
And so the patient's still out.
I got to tell you, if I go to the bathroom, I got to have a little snack, got to eat a little something. Yeah, you can take a break.
And
The anesthesiologist is there. The patient's safe. You go. You got to be fresh.
yeah, because I've always wondered. There's obviously long.
I got to get that blood sugar up a little bit. Got to have a little snack. Let's do it.
That's crazy. And then the anesthesiologist obviously is the one that puts you out, right? Are you guys always? I always remember this. I remember when I think it was my second child with my ex-wife. I remember the surgeon or whoever was delivering the baby, and the anesthesiologists were arguing in the room because
You're arguing.
well, the surgeon wanted it. The surgeon wanted my ex-wife to be put out because she was kind of hyperventilating. She was getting nervous. It was a cesarean, I think, and she was getting.
Usually they give a block.
And it was she was panicking. She was having like an anxiety attack, I think, from memory. And I think the doctor said, "Just put her out." And the anesthesiologist said, "I don't want to put her out right now. She's not ready to go out." And they were having this discussion back and forth, and as
You're sitting there watching.
for the father, it's always the worst because we have zero control. We're completely awake. We're seeing everything, right? And I remember just doing this, and like I kept my mouth shut, but the Arab Lebanese in me wanted to be like, "Hey, what's going on? Why are you guys arguing? Look after my wife." But I remember they had this. The doctor ended up overruling. I don't know if it was overruling, but the anesthesiologist put her out. Put the thing.
Yeah, the ET tube.
It was like and just it was. I remember I'm scarred from that. Is the anesthesiologist and the doctor meant to work hand in hand closely? Are you guys?
Oh yeah.
Like it's like.
You have to discuss that. I mean, the captain of the ship.
Yeah. Who
is the surgeon in general.
Okay.
Now, when something happens so he's the one who's responsible, he or she. But the anesthesiologist, of course, if there's a problem with the airway or a problem with something, you have to work. That anesthesiologist has to know what they're doing, the right medication, the right drugs, the right everything. Because it's going to be the anesthesiologist. The surgeon is going to help, but you have to have a great working relationship with the anesthesiologist.
You are a ENT specialist, right?
Even though I don't do any ENT.
But you know it all.
But that's what I was trained.
All right. And so I'm going to get free advice right now. This is great. I don't know if you can give it to me. So I have a thyroid goiter here.
Yeah.
It's like 4.5 centimeters, fairly large.
Okay, on one side?
I've got them all over, but this is the big one, right?
Okay.
And initially when they tested it all, they were like, hey, it could be cancerous. We have it within the family. Yeah. They did the biopsies. It looked all hot. Like I think it looked hot. It ticked 5 of the 7 boxes or something. Came back, it wasn't. They're like, it's okay. We did it again a year later just to double check. The biopsies, which I've heard don't do too many biopsies because that can actually do something bad. But anyway, I had a couple of doctors say, hey, I think we should just take it out. We should remove it. It's not doing anything, but it's there. Me looking into it and speaking to a few people, they get close to the vocal cord. Mm-hmm. My whole life
is
speaking. The money that I make for my family is because of my voice. Mm-hmm. And I always said, I'm not doing it. I don't want to go anywhere near it because it's near the vocal cord. Is it near the vocal cord? Is there a chance that the vocal cord could be clipped and it damages my voice?
Yeah, so there's a recurrent laryngeal nerve that can be damaged with taking out a thyroid. Mm-hmm. It's rare, but it could be. But if you got a goiter, listen, I got all kinds of patients that have goiters.
Yes. Well, I only found out.
Or nodules.
Yeah, it's a nodule, yeah.
It's a nodule, I think you just watch it. Mm-hmm. So I would not take it out.
Okay.
As long as you have a good doctor who's watching it.
I get an ultrasound on it every like 7-8 months to see if it hasn't grown. It hasn't, touch wood, it hasn't moved.
I absolutely agree. That's exactly what I would be doing.
Okay.
And plus, here's the good news. Let's say the worst thing happens and it becomes a little cancerous. You take it out. This is not something, if you have to have a cancer.
It's that one, right?
It's the thyroid or basal cell carcinoma of the skin or the thyroid.
Yeah, I heard that.
You're fine.
Yeah. And then you take it out, but then you're on the meds, right? You're on those.
Well, you're on Synthroid.
Yeah, to get it all done, which I don't want to do. I don't want to. There's one thing that I don't
leave it alone right now.
Just leave it alone right now.
Just watch it and that's it.
You having fun? Life is good?
I'm having a blast. I got to tell you, traveling here without part of my family now is hard. I miss them. So I enjoy being with my family. That's what I'm enjoying. I mean, I'm enjoying. I moved to the beach, so I have to travel all the way to Beverly Hills.
Yeah, which is
I live pretty far away. I wake up, the ocean's in front of me every day. I love walking on the beach. I love working out, lifting like you. I love hanging out with the family. I love I still love operating. Someone asked me the other day, I'm 63, when are you going to retire? I'm not going to retire as long as I can because I'm actually getting better with surgery.
Yeah.
Still better. I want to slow down so I can enjoy myself more eventually, another couple more years, but I'm still going to operate. So I'm having a blast. I mean, I'm enjoying things.
That's cool. Yeah, I think it's important to, I've been saying recently on this podcast and on my radio show and even on social, like, slow down a little bit, enjoy it more, because you just, you never know when your time is up.
You never know.
You never know.
I mean, for me, I got 5 kids I got to support.
Yeah.
I kind of like living in this beautiful house in the ocean. You got to keep working a little bit for that. But the other time, it's fun. I got to tell you. And listen, this is you've had some great people on your podcast.
Yeah.
And I'm sure every one of them talk about enjoying family.
It's funny because a lot of them all say the same thing, which you just said, which is we love our family, but it costs to run a family, and I can't just stop.
Exactly. That's true.
The responsibility. Paul, always a pleasure, man, and hopefully we get you back here, and thanks for just being you, and thanks for waving the Lebanese flag proudly as well, because I think it's important. Yeah, you do, so thank you, man. We'll see you soon.
All right, brother.